Thank you. It's my welcome address now. Good evening, dear District Governor, Lion Rajkumar, and Patron of District Landladies Committee, Lion Marian, past International Director, Lion Sunil Vatawala, immediate past District Governor, Lion MIM Rasik and Lady Lion Rizana, first VDG Lion Dr. Anoma Vijay Singha and spouse PDG Lion Lakshman, second VDG Lion Placidus Peter and Lady Lion Savitri, all respected past district governors and their spouses. Today's guest speakers, Consultant Community Physician Dr. Suraj Perera and Chief District Coordinator, Cancer Awareness, Consultant Pediatrician, Lion Dr. Manel Fernando. Leo District President, Manel Perera, all Lions from our Izami region, are all honorary consultants and chief advisors to the Lion Ladies Committee, members of Lion Ladies Committee, dear Lions, Lion Ladies, Leos, friends, ladies and gentlemen. On behalf of the Lions Ladies Committees, I warmly welcome all of you. My special welcome to our guest speakers in this evening, Consultant Community Physician attached to National Cancer Control Program of Ministry of Health, Dr. Suraj Perera, and our own Lion member, Consultant Pediatrician, Lion Dr. Manel Fernando. I believe as mothers, wives, and sisters, it is very important that we are made aware of breast cancer, which has become a very common issue in today's society. As most of you must be knowing, the month of October has been set apart for breast cancer awareness, and such we have made arrangements to further educate and enhance your knowledge on this very timely topic, which I am sure will benefit all you ladies watching via this virtual platform. It is our intention that our dear ladies keep well in this area, as we are the backbone of our community and families. Towards the end of this program, we will be having an open forum for questions and answers. Please do feel free to clear any doubt you may have. You could either ask directly, unmute by yourself. Even you can use the chat box or send personal WhatsApp messages to me or our patron Lion Marian. We will make sure not to disclose your names when we present the questions. Be comfortable of asking any concerned matters or clarifications on behalf of your friends or relatives. Therefore, I request you to take maximum advantage of this given opportunity. We would also be opening a poll to rate today's program to evaluate the success of today's interaction session. Hope you all have a pleasant and educational session. Thank you and God bless you. Thank you. It's time for the address of our patron, First Lady, Lion Marian Rajkumar, MJF, MF. Now I invite you to address the gathering.
Thank you, Chairperson Lion Dulanthi. My dear Lions, Lion Ladies, Leos, guests and invitees. 2021 has been a challenging year for all of us. The COVID-19 pandemic has disrupted the lives of every one of us. I know that it has been also difficult, particularly for cancer patients and their families. Treating patients delayed screening and affected access to medicines. It has added a new layer of risk for patients and creating more worry and stress for families. It is at this stage the Lion Ladies Committee embarked on this all-important breast cancer awareness program, which is also a part of our district governor's 8-point program for the fiscal year 2021-2022. During the past 2 years, we have lost 4 lady lions who were very active in the district, namely our dear Lion Manel Vatawala from Lions Club of Nigamba Host, Lion Lakmali Jayasundara from my home club, Lions Club of Pamunugama Jaila. And last week, we lost Lion Shanti Ravindran and Lion Rose Fernando of Lan Shanti from Lions Club of Colombo Grand Way, and Lan Rose from Lions Club of Migambo Host. All these lions are lion ladies lost due to cancer. I humbly urge women to continue seeking advice and screening to detect breast cancer at the earliest possible. Beyond this, cancer also has a tremendous financial impact. It places a massive burden on our health and social systems. It does not only affect the patient, but it also affects families and their friends as well. It becomes the source of many feelings and emotions of sadness, anxiety, anger, denial, even helplessness. Cancer concerns all of us in one way or another. It does not distinguish between religions or race, sex or age, and that is why we all need to join forces to make a difference, especially if one looks at the stark numbers looming in the future, which suggest cancer cases will increase in an alarming way. We cannot be bystanders with no control over our lives or our health. My dear participants, how do we slow and reverse the increase in cancer rates? How to be secured by ourselves? Today you will learn how we identify early warnings as early detections to save lives. Cancer is no longer just the responsibility of the health sector. We as landladies should take a lead role, organize awareness in schools, in the workplaces, and in social groups. Prevention will, of course, always be the best cure of all. My dear all friends, join with our great Lions movement, the world's largest service organization having 1.45 million members in over 210 countries. I can see a lot of non-lions are there. I invite all non-lions here to join with us. We give our contact numbers in the chats. Give your suggestions for any more training and awareness programs you are required. Our strong chairperson and Lion Ladies Committee is ready to do our best to serve all of us and also the needy. Today, we have two eminent resource persons who will enlighten us as to what we must do to protect us from this deadly disease. We serve with love. Thank you, and may God bless all of you. Over to you, Chairperson.
Thank you, Patron, for those words of encouragement. Coming back to the program, it's time to introduce our guest speaker in this evening, and I invite Lion Ione Algama from Lions Club of Wattala to do the honors. Over to you, Ione.
Thanks a lot for giving me this opportunity to introduce today's guest speaker, Dr. Suraj Perera, who is a proud product of Royal College, Colombo. He graduated from, yes.
You have to turn your device.
He graduated from the Faculty of Medicine, University of Colombo, obtaining MBBS qualifications in 1999 and obtained Masters in 2004 and doctorate in 2007 in Community Medicine from the Postgraduate Institute of Medicine, University of Colombo. He obtained a diploma in Principles and Practice of Cancer Prevention and Control from the National Cancer Institute, Maryland, USA in 2008 and postdoctoral training at the Divisional of Public Health and Primary Care, University of Oxford during 2008-2009. Further, he obtained the following qualifications, adding feathers to his professional cap. a certificate program on cancer registration and cancer epidemiology at the International Agency for Research on Cancer of the World Health Organization, Lyon, France, in 2010. Certificate course in palliative care conducted by WHO Collaborating Center for Palliative Care and Long-Term Care, Kerala, India. Fellowship on Palliative Care from WHO Collaborating Center for Pain Policy and Palliative Care, School of Medicine and Public Health, University of Wisconsin, USA, for a period of 2012-2014. 6 weeks master trainer program to enhance palliative care capacity and leadership in Sri Lanka, conducted by Asian Pacific Hospice Palliative Care Network and Lien Foundation of Singapore during 2015-2017. He is having a vast experience being a member National Advisory Committee on Prevention and Control of Cancers, a member National Steering Committee of Palliative Care, a member of Palliative Care and End of Life Care Task Force of SLMA, more than 15 years work experience in public health, program planning, implementation, monitoring, and evaluation of national and provincial levels in Sri Lanka. Experience in working in partnership with United Nations, UN agencies, WHO, World Bank, WHO, World Bank, and non-governmental organizations. Further, he is a young visiting lecturer to the University of Colombo, University of Kelaniya, University of Sri Jeewantha Perera, Kothawala Defence University, and Postgraduate Institute of Medicine. Let me share with you another important information received a few minutes ago. Dr. Suraj Perera is the first cousin and a well-known lion in our district, which my doubts proved by looking the faces of both of them. Any guesses? He is the first cousin of our Cabinet Secretary, Lion, Dr. Jeewantha Perera. My dear lions, lion ladies, viewers, and guests, let me warmly welcome our guest speaker tonight, Consult Community Physician, attached to the National Cancer Control Program of the Ministry of Health, Public Health, specialist in cancer prevention, early detection, survivorship, and palliative care and cancer registration, Dr. Suraj Perera.
Good evening. Thank you very much for the kind introduction. Thank you, Dr. Jeewantha, Dr. Manel Fernando, and all Lion ladies for inviting me for this symposium. So let me first talk on overview of breast cancer in Sri Lanka. Then after that, Dr. Manel Fernando will give further insights how we can detect breast cancers early, and both of us will join for the question and answer session after that. So in my presentation, there may be slides with numbers, because I am using these actual numbers not as an academic exercise, to give you a good insight at the current situation in breast cancer in Sri Lanka, where a lot of interventions, where some information may be very relevant for you. Some information is relevant for you to take action for your family, as well as will give good insights to take community action. As I am well aware that Lions are one of the leading civil society organizations. So based on these facts, you can design interventions in community level, because we are heading for the World Breast Cancer Awareness Month in October. So thinking all of these aspects, I will give initial thoughts for you regarding overview of breast cancer. So we all know main function of breast because all females are blessed with breast to feed the next generation. But as you mentioned, your colleague mentioned, there is an issue in relation to breast because we are aware that about 196 countries are in the world. Out of that, more than 160 countries, the highest number of cancer among female is breast cancer. If you look at a world map of breast cancer, world map of cancers, you will notice that more than 160 countries are colored with pink because among females, commonest cancer is breast cancer. So to understand the breast cancer, it will be a little bit helpful if you go, to get some insights about the components of breast, the little anatomy, whereas medics we used to learn on in deep, but for you also it may be helpful to understand the breast cancer, right? So this is the outer appearance. When you look at cross section, longitudinal section, you will notice that breast is composed of ducts as well as lobes. The milk is produced in these lobes and secrete to these ducts to the nipple when during breastfeeding days. Right? So the rest of the thing is fatty tissue. So this is a longitudinal section of the female breast. Now, and other thing is you may be aware that among males also breast cancers are reported, not as large in numbers like among females. So among males, you will notice these lobes are not developed. So they also have ducts, but the rest of the area is composed of fatty tissue. Right? Now, this we generally say cancer is uncontrolled, purposeless growth of abnormal cells. Uncontrolled, purposeless growth of abnormal cells. In Sinhala, we used to say, "Agamunak rahitawa පාලනයකින් තොරව සිදුවන අසාමාන්‍ය සෛල වර්ධනයක් පිළිකාවක් ලෙස හඳුන්වනු ලැබේ." So this uncontrolled, purposeless cell may go, abnormal cell may go in these lobes. Then we used to, it may develop in these ducts. When in the breast, when these ducts, abnormal cells are formed and become malignant potential, we used to say invasive ductal carcinoma. Now, if you come across histology report of a breast cancer, you will notice some of the females were diagnosed having invasive ductal carcinoma. That means that abnormal cells, cancer has started from these ducts. In some instances, you may have noticed reports came as invasive lobular carcinoma. Then cancer has started from these lobules where the milk is produced during lactation period. Then we say invasive lobular carcinoma. So these are the two main types, ductular carcinoma and lobular carcinoma. So based on the site of origin, we used to name these types of cancer. Now we will look at current situation in Sri Lankan scenario. So I am aware that in this audience there are participants from different parts of the country. So even though our priority here is early detection, I at this moment, before coming to numbers, I need cancer centers throughout the country. About 10 years ago, we had centers all over the place. Country people has to come to a central hospitals, the main hospitals for cancer care. Now, last 10 years, cancer care has decentralized to the district level also. You will notice now we have 25 cancer centers in the country. Consultant oncologists, who are the team leaders in cancer care, are appointed to all these 25 cancer centers. Now, the main cancer center is National Cancer Mahagama, now called Apeksha Hospital. Now you will notice within Western Province also we have several other cancer treatment centers. Now North Colombo Teaching Hospital, Ragama, there is a cancer center. Very soon there will be a dedicated unit adjacent to the Ranaviru Sevana, where Jeewantha family has donated a cancer center. So Ragama has a cancer center. Then Gampaha District General Hospital, Chilau. I am aware Lions has also given some donations to these cancer centers. Like that way, these red dots are the main cancer centers. These yellow dots are the regional cancer centers where radiotherapy facilities will not be available. All these red dots, radiotherapy facilities are available or will be available within next this year or next year. That means every province will have a fully blown cancer treatment center in addition to satellite these regional cancer centers. So in comparison to most of our regional countries, now people have good access to cancer care in the country. No need of coming to the Mahagama or the other leading cancer centers, because now cancer care is decentralized. And if you want to look at the cancer burden, one of National Cancer Control Program's unique duty is publishing this National Cancer Registry. Now we have finalized up to 2015, and now these days we are finalizing up to 2019. I will share my data up to 2019 because these days the final reports are with the printers. There is some delay in printing the final reports. So if you are interested, if you are writing any, if you are quoting cancer data for your project proposals, please access our website. This is our website. If you need any other guidance regarding cancer data, we are ready to provide. Now, we have continuous data from 2005 to 2019. This is about all cancers. In 2005, you will notice we have reported in Sri Lanka, reported only 13,000 cancer cases. Now in 2019, 31,000 cancer cases were reported to our system. So we are assuming that this number may be a little bit higher, considering because some of the private sector data still we are not receiving. So we are assuming that around 34,000, 35,000 cancers are reported per year. So always female cancers, number of female cancers higher compared to the male cancers. Now you will notice in 2019, it is 16,900 female cancers were reported in comparison to 14,800 male cancers. So you will notice cancer rates are going up. And this in this moment, I need to mention that all over the world, cancer incidence is going up. The more and more cancers are reported. It is not only unique to Sri Lanka. From USA, UK to Australia, every country cancer rates are going up. So in our data also, it clearly shows cancers are increasing. Now our main topic today is about breast cancer. Now this is breast cancer. Now this is 2005, 1,859 breast cancers were reported. In 2019, 4,447 breast cancers were reported. So this number may be little higher than this because some of the private sector data we haven't received. So we are assuming that about 5,000 breast cancers are detected per year now among females. So that means 5,000 breast cancers are detected per year. So among males also about 100, 150 breast cancers are detected in a year. So that's the scenario. Then when we plot this into a bar chart, you will notice breast cancer, number of breast cancers are increased over the time. Now, if you Google any country at this moment, from developed country to developing country, any country, breast cancer rates are breast cancer numbers are going up, breast cancer incidence rates are going up. Still, actual reason is not identified why breast cancers are increasing. Now, this is this blue bars are for females. These yellow ones are for males. Now we plotted according to the age at diagnosis of breast cancer. Now you will notice majority of breast cancers now we plotted for last 5 years, 2015 to 2019. Now you will notice majority of breast cancers are detected among 45 to 74, that range. That means majority are postmenopausal breast cancers. But you need to keep it remember that fair amount of young breast cancers are detected. Now you will notice even 20s, few breast cancers are detected. Now, consultant pathologist in National Hospital, she mentioned that 2 medical students were diagnosed having breast cancer. That means they are in 20s, early 20s. So that's why all our messages, now Dr. Manel will share those information. That's why we are inviting every female to be aware about any changes of their breast from 20 onwards. So even though a small number of breast cancers are reported in 20s, we need to be aware, our females need to be aware about identifying any breast change, any abnormality as early as possible. Majority of breast cancers are detected after 40s, but these area we cannot ignore, because other concern is among young breast cancers is compared to the breast cancers reported among older females. Young breast cancers are little bit, some of the breast cancers are aggressive. So therefore, we need to take urgent interventions. It may be surgical intervention, it may be chemotherapy intervention, it may be radiotherapy interventions. Young breast cancers need early interventions. So therefore, don't ignore these young age groups. Any change of breast, please contact medical team. Now, you will notice by looking at numbers also, now about 1/3 of breast cancers are detected before the age of 50. I am highlighting this because according to the guidelines, mammogram is recommended at the age of 50 for routine screening. It may be in Sri Lanka, it may be in Australia, it may be UK. The recommended age is 50. Only in USA it is recommended from 40 onwards, because USA health system is insurance based. So they are a little bit proactive considering their healthcare cost after detecting. So they have reduced the age of mammography screening, but majority of countries the recommended age for screening. That is for normal female for undergoing mammography screening at the age of 50. So you will notice that we can't wait till mammography screening at the age of 50. Before that, 1/3 of breast cancers are detected. So these data, even though these are numbers, these are our Sri Lankan females detecting breast cancers before the age of 50. They are giving a good message to all of us that we need to be vigilant. We need to be cautious about any breast change from 20 onwards, because 1/3 of breast cancers are detected before the age of 50. So I am highlighting in different ways to share this message, because this is very important compared to the developed world. Developed world, the major like us, the majority of breast cancers are after the age of 50. But the proportion of young breast cancers is a little bit higher in Asian countries, our region. That's why I'm highlighting that, especially between 20 to 50 age group females also need to be aware about identifying breast change as early as possible. Even when we plot subsequent years, successive years, also it clearly shows about 1/3 of breast cancers are detected before the age of 50. Then we looked at when we want to compare our breast cancer incidence rates, we need to divide from a total female population, and we need to do age standardization to compare with the rest of the world. We need to standardize. When we do this mathematical calculation, also it clearly shows that our breast cancer rates are going up. So if I simplify this, now into 2019, the rate is 33 per 100,000. That means every 100,000 females, about 34 breast cancers are detected per year. Now, compared to the USA, UK, this number is a little bit low, Australia, but our rates are also going up. This is the blue line is male cancers. So I told that about 4,500 breast cancers are detected per year. So if I divide this number from 365 days, that means about 12 breast cancer patients are detected per day. That means 12 females are affected, 12 families, and 12 patients are added to our healthcare system, breast cancer patients. So our now compared to now, we are well aware about cervical cancer. When we compare to breast cancer, cervical cancer is a preventable cancer. Our target for cervical cancer is prevention. For breast cancer, we are not aware about exact preventive measures. We means the entire world still not aware about how to prevent breast cancer. Our aim is detect breast cancers as early as possible to make breast cancer treatable cancer. Now, one of your previous talks, you mentioned breast cancer is a deadly disease. Now we are not using that word, because breast cancer is a curable cancer now. Now, a lot of advanced treatment are available. Now, if we consider cure rate, about 10,000 cured breast cancer patients are in the society. There are politicians, female politicians. There are well-known celebrities, doctors, nurses, school teachers who were detected having breast cancer and got early treatment, successful treatment. They are in the society. So therefore, we are not telling breast cancer is a deadly disease, because breast cancer is a curable disease. we can cure if we detect cancers as early as possible. So our aim is not to prevent breast cancer. Our aim is detect breast cancers as early as possible and offer most suitable optimal treatment to achieve cure. Now, when we look at female cancers, I told previously also about 16,000 new cancers are detected among females. Out of that, 1/4 of cancers, part of cancers are breast cancer. So among females, the commonest cancer is breast cancer. You will notice these thyroid cancers are also increasing. Earlier, it was cervical cancer. Now cervical cancer has taken 4th place. Now you will notice over the years, our cancer pattern is changing. Now we are wondering why breast cancers are increasing. We are wondering still, we haven't come across a clue why breast cancers are increasing. Same as for thyroid cancer. Thyroid cancers are also increasing. Now colorectal cancers are also increasing, but it is explainable because of food pattern and all these things are changed. So the reason we are aware our social cultural changes, but for these things still actual causes are not known. So my message is 1/4 of breast cancer, 1/4 of female cancers are breast cancers. Now, if we look at successive years, so you will notice that every year when we look at our cancer detection rate, the proportions, 1/4 of breast cancers are 1/4 of female cancers are breast cancer. Then I will come to now. I highlighted that breast cancer rates are going up. It is a common cancer among females. Now we will look at mortality. Now this is I am quoting from Registrar General because Registrar General used to publish cause of death data. This is 2013 because there is a delay in publishing final data. We have up to 2014 only. Now in 2014, about 700 females died due to breast cancer. That means this number may be more than this because some may have not declared that their loved one died due to breast cancer. So about more than 700 patients, females have died due to breast cancer. Now this is 2013. This is 2014. So that means 2 deaths are occurred due to breast cancer per day. That means we are losing 2 females. We are losing 2 mothers every day. So this may be a little bit higher, maybe 3 or 4. So that is a sad story because breast cancer is a curable cancer now. It is a treatable cancer. So we in Sri Lanka, we may have failed to detect early, or we may have failed to treat early, or we may have failed to treat successfully. So if we are heading for success story, we need to reduce this death rate. Now this is USA experience. Now you will notice because they have mortality data from 1950 onwards. Now USA, before introducing mammography, because in USA the screening mammography was screening 1975-76 that era, and new mode of treatment was available in late 1970s. Even before early screening, early latest treatment, breast cancer mortality was, deaths due to breast cancers were reduced because because it was due to early diagnosis. That means we don't now in our setting still government sector is not providing free mammography for every female after the age of 50. So therefore we need to empower our females that to check their breast using other alternative methods. Dr. Manel will describe how to do self-breast examination, how to be aware about your own breast. So we need to empower our females not to detect breast cancers by themselves or breast change by themselves. So even US experience, they say they are showing that by simple early diagnosis method also you can reduce mortality, because in your I am addressing to the lay people now. When we address to the medical community, always they are saying the Ministry of Health is not providing adequate mammography machines, adequate treatment options, those things. That's why our people are dying. So there may be some part it may be true, but we need to empower our females for early detection using other methods rather than depending only these methods only. Then and this is I'm quoting from a recent publication by Dr. Jeewantha Perera and Dr. Murad Joseph and that team. They look at our breast cancer survivors. Now I need to highlight that thing, because now we are not saying breast cancer is not a deadly disease. Now even this research, because they have followed up large number of breast cancer patients for more than 5 years. This research study, they contacted their registries, they contacted patients of using the existing info contact details, and they have noticed that more than 71% of early stage breast cancers were survived more than 5 years. So this is a research study, Dr. Balavardhana, Dr. Skandaraja, Dr. Vasantaratna, and Raj Joseph. So key message here is breast cancer is now not a deadly disease in Sri Lankan setting also. But we need to ensure that we need to detect breast cancers as early as possible to allow our dedicated, our experienced consultant oncologists to treat them successfully, our surgeons to do the curative surgeries as early as possible. So then we can be also, Sri Lanka also can be proud that our breast cancer survival rates are high, more than this. Now, if we look at UK or Australia or Canada data, they are showing that more than 85–90% breast cancer survival rate, because they have good screening program, they have good treatment program and good follow-up program. Only US a little bit low because their treatment costs are high, as you are aware. Those who have insurance schemes, they can afford. If not, they may not get optimal care. But these free health systems available in US, UK, Canada, Australia, survival rates are high. Then these are the methods. So I will not discuss. Dr. Manel will discuss about these methods that we need to empower our females to do early, to do self-breast examination, to go to a health and wellness clinic or cancer detection center for clinical examination. Appropriate time need to go to the mammography for mammography screening. So we need to encourage, facilitate, support our females. Then finally, I will mention few things now. I think you can remember these two figures. This is Susantha Chandramali, her daughter. About 8 years ago, they appeared for our poster requesting early detection, appealing females to early detection of breast cancer. With this mother and daughter, we did posters, leaflets, and television advertisement, advertisement and radio jingles. And later she was diagnosed having breast cancer. Susantha Chandramali, her daughter. Then even after, this is our current director, Dr. Janaki Dhanapathigan, even after detecting breast cancer, while on treatment now, she came for our activities. She's appearing for our education activities for early detection of to promote breast cancer, because she was detected early and she had successful treatment. Then finally, I need to mention our Cancer Early Detection Center. This is located at Narayapeta. So this is a concept we are promoting in Sri Lanka, walk-in clinic. Anybody can walk into our clinic, and this is supported by Rotary Club Colombo. It's a public-private partnership. So we purposefully located this out of a hospital setting, because now if you go to other countries, you will notice that this cancer early detection is not a hospital activity. It is some kind of out of hospital activity. So we want to promote that concept, that anybody want to check, get them checked, can walk in. So our team is available. So it is free of charge. Earlier, anybody can walk in, because these days, due to the COVID situation, we have introduced a appointment system. When this COVID situation is over, again we will allow anybody can walk in anytime. So this concept now we are promoting to other provinces also. Already Jaffna Cancer Detection Center was started at Jaffna Hospital, and very soon Matara, another NGO, Cancer Care Association, they are offering their premises to start this Cancer Detection Center in Matara. Like that, we are trying to either within the government hospital premises or any other suitable setting to start this kind of service. So the human resource will be provided by the Ministry of Health, and if it is in government locality, all the resources will be also from the Ministry of Health. Now in our setting, cervical cancer screening is offered pap smear, and in addition to HPV testing, now latest cervical cancer testing is human papilloma virus testing. That testing facility is available. Then breast cancer cell breast examination is taught by our team, and clinical breast examination is conducted by our team, doctors and nurses. And we have in-house on-site mammography screening. So we do mammography screening, and if there is any need, we have to refer to the national hospital, but it is a arranged appointment in collaboration with national hospital, that for the ultrasound scan and complete reporting. So all the services are free of charge. Then oral examination is conducted by a dental surgeon, and we have in-house ultrasound scan facility also. Our doctors are trained on ultrasound, but since to give the final conclusion, we need consultants endorsement. That's why if there is any doubt, we used to refer to national hospital as a special case, not again as a waiting list patient. So we have a special arrangement with national hospital for the needy clients, for the advanced investigation. So our center, anybody, if you come across any person who need free early detection services, you can direct. It is at Narayapeta, just opposite Kirimandala Mawata Junction. And this is our in-house team. In addition to our other doctors and nurses are also attend. This is Dr. Dumindo, medical officer in charge, our Dr. Dulanthi, our medical officer, and this is our nursing officer in charge. These two are the nursing officers, and this is assistant. And please visit our website also. It is ncp.health.gov.lk. A lot of educational materials are there, and you can access and you can contact with us. And even for this cancer detection, now these days we have introduced appointment system through this website and our Facebook page. You can get an appointment to a cancer detection center. And mammography also available. And in addition, one of our key activities, developing guidelines for healthcare staff. We have developed national guidelines on breast cancer detection, and most of the cancers detection guidelines are developed. I think Dr. Manel will also refer these guidelines during her speech. And I need to mention tomorrow is an important day for us. Now our next step was, after developing early detection guideline, first time we were able to develop national breast cancer management guideline. Tomorrow we are going to launch through a Zoom this guideline. So we are targeting the medical fraternity, but if you are interested, because this will be a little bit technical, but I can share the web link, and it will start at 2 o'clock and end up at 3:30. The leading consultants, oncologists, consultant surgeons, pathologists are discussing about this guideline. If anybody is interested, you can join. So it is a remarkable day for the country. First time national guidelines are available for breast cancer management also. I am not saying that before that we manage patients without having guidelines, because we followed our guidelines practicing in other countries, UK or Australia. So first time now Sri Lanka has our own guidelines, Sri Lankan guidelines. So all Sri Lankan experts got together and developed that guideline. So it will be launched tomorrow, and it will be hosted at our website. Anybody can look at, because we are well aware about now patients, family members are referring internet when one of their family member got illness. So please, if you need any information, please refer these guidelines. So I will stop here, and my senior colleague and one of leading pediatrician in the country, Dr. Manel, will discuss about early detection aspects related to breast cancer. Thank you.
Thank you, Dr. Suraj Perera, for that informative and elaborate speech covering all the areas of cancer with explanations on the prevailing situation of the country. I would like to remind that he is the most qualified professional to speak on this subject, as he is the consultant attached to the National Cancer Control Program at the Ministry of Health, Sri Lanka. Once again, thank you, Dr. Suraj. Well, we do not need any elaborate introduction of our second guest speaker, as she is the well-known personality, our own member in our district. But in keeping with the tradition, I call upon Lion Premi Vasantha Kumar from Lions Club of Negombo, Zenith, to do the honors. Over to you, Vasanthi Premi.
Thank you, District Lion Ladies Chairperson Lion Dulanthi. Good evening, everyone. Thanks, dear Patron Lion Marian, for giving me the opportunity to introduce our second speaker today on this very important topic. She had her primary education from Ave Maria Convent, Negombo, and had her secondary education from Harichandra College, Negombo. She had her MBBS graduation from University of Colombo in 1981 and acquired the following postgraduate qualifications: Diploma in Child Health DCH, Colombo in 1991, Doctor of Medicine MD, Pediatrics in 1996, Member of Royal College of Physicians, MRCP, United Kingdom in 1998, and Fellow of Sri Lanka College of Pediatricians in 2019. During her postgraduate training, she served at Sri Jeewantha Perera Hospital, Kotte, and Lady Ridgeway Hospital for Children, Colombo, and Birch Hill Hospital, Rochdale, United Kingdom, in addition to her consultant pediatrician in Batticaloa, Anuradhapura, Chilo, Cleopatra, Negombo, and Colombo North Teaching Hospital, Rajkumar. Further, she serves as a lecturer and an examiner for MBBS, DCH, MD Pediatric, MD Family Medicine, and ERPM exam at Postgraduate Institute of Medicine, Colombo. She is having a special interest in childhood respiratory diseases and became the president of Childhood Respiratory Disease Study Circle of Sri Lanka since 2018 and contributed to national guidelines on management of asthma in children published by the Sri Lanka College of Pediatricians in 2019 by being a co-author. She is a life member of Sri Lanka College of Pediatricians, Sri Lanka Medical Association's Perinatal Society, Allergy and Immunology Society, and also a member of Child Protection Committee of Sri Lanka College of Pediatricians. She joined the Lions in 2009 in Lions Club of Negombo, became the club president in 2012-2013, and currently holding the responsibility, the Charter Club Secretary of Lions Club of Negombo. She held following responsibilities in the district cabinet since 2014. District Chairperson, Kidney Awareness and Action 2014 and 2015. District Chairperson, Child Healthcare 2015 and 2016. District Coordinator, Child Health Care and Nutrition 2016-2017. Chief Coordinator, Pediatric Cancer Awareness and Prevention 2017-2018. Chief Coordinator, Child Care, Pediatric Cancer Awareness and Prevention 2018-2019. District Governors Coordinator, Child Health Care, Pediatric Cancer Awareness Prevention 2019-2020. Chief Coordinator, Cancer Awareness and Prevention 2020-2021. Chief Coordinator, Pediatric and Breast Cancer Awareness 2021-2022. She is qualified from Regional Lions Leadership Institute, RLLI, in 2012, and Advanced Lion Leadership Institute, ALLI, in November 2018. She is married to Lion Premasri Niwarapaksha, who is the Chief District Coordinator, Breast Cancer and Pediatric Cancer Awareness, 2012-21, 2022. My dear Lions, Lion Ladies, Leos, and guests, I am proudly present experienced consultant, Lion Dr. Manel Fernando, to address all of us on how we could have early identification of bad symptoms of a cancer. Thank you, and may God bless you all.
Hi, Bowan. Vanakkam. Good evening. Thank you very much, Lan Premi, my dear friend, for your kind introduction. And I take this opportunity to thank the patron and chairperson and landladies committee for the invitation rendered to me to participate in this valuable forum. So I'll share my screen. Right, breast cancer. Now you can see a ribbon there, it's pink. So every cancer has a ribbon allocated to that cancer. So breast cancer is allocated, the ribbon color is pink. So we are wearing pink. I think the landladies, the committee, the people are wearing pink. So we are wearing pink because we are supporting breast cancer awareness. The introduction, as Dr. Suraj said, I took this information from the National Breast Cancer Guidelines. So all these things you have already listened to what Dr. Suraj said. This is the most common cancer among women, and then it's newly diagnosed about 24%, but according to his statistics, it's going on to about 27%. Now, for a year, 3,500 is, it has become 5,000 now. So it's not 10, but it's 12 ladies will be identified with breast cancer. And 1/3 of these ladies are identified later. So that is the problem. And the other thing is, for a year, about 700 will lose. So 2 ladies will lose their life per day. So these are, every day 2 ladies are dying because of breast cancer. So as informed to you all, the incidence increases with age. So peak ages are 45 to 65. And other thing is that we think that males won't get the breast cancer, but yes, they are also getting, it's rare, but the males also can get breast cancer. So this was shown to you by Dr. Suraj. So the important point is this breast is consisting of muscles, these are muscles, and then you have the fatty tissue, and then the glands, and then the ducts, and which will go out, the milk will be secreted from the nipple. And this part I will just show you because there are lymph nodes in the axillas. So most of the time ladies say when they remove the breast, they remove the breast as well as they remove some things in the axilla also. So because the cancer cells can go into the lymph nodes, and these things will be hiding there and it can come up later. So because of that only, the axillary lymph nodes also removed when a breast is removed. So what are the risk factors? Who are the people who can get cancers? So about 90% are environmental factors, but 5 to 10 are genetic. So as Dr. Suraj said, that we don't have any way to diagnose that cancer. So the main thing is to prevent. So to prevent, we have to know what are the risk factors. So getting on to the personal factors. So females to males, the ratio is 100 to 1. So for every 100 females, 1 male will be getting a breast cancer. The age, again, about 75% will be diagnosed by the age of 40 to 69 years. And then the other factor, the personal factor, is the breast, the glandular tissue in the breast. This is not the size of the breast. Don't think that if you have a big breast, you are going to get a cancer. No, it's not that. But if you have a lot of glands in your breast, the density of the glands will make the risk factor is more in ladies who are having more glands in their breast. And the family history, this is very important. Anybody in your family, anybody had a breast cancer or an ovarian cancer. So these things, if you have a family history, you have to be very careful, because if you have a first degree relative, who is a first degree relative? It is your mother, your sister. So the immediate family. So if one of them had a cancer, you have a chance of getting 5.5%. if one of your family member is affected. But if suppose your two sisters had breast cancer, your chance is 13.3% of getting a breast cancer. And then the other thing is, if the relative, if your sister is diagnosed at a young age, then again your risk is going to be up. And both sides, if it's not only the mother's side, but the father and mother, both sides, if somebody had a cancer, your chances are high. So if your family, somebody is having a cancer, you can't be just ignoring, or no, you can't say that I won't get. No, you are going to get, you have a chance. So because of that, we have to be careful. And these days you are listening to a lot of these mutations, the Vikurti Jana. So a lot of mutations, we are talking about the virus, but there are this type of mutations that is called BRCA1 and BRCA2. The men and women, they can have this gene and they can pass, either the mother or father can pass this to the child. And there is a 50% of, if the mother has this gene, there is a 50% of chance that the child will get the gene. The problem is if we can identify these genes early. In our country, it's a little difficult, but then there are gene analysis laboratories, so they can do this gene analysis, but it's very expensive. But the advocate is that if your family 2-3 people are having breast cancer, then you can get all the ladies and then get a kit and they can go to gene. There's a gene analysis unit in the medical faculty Colombo also. So to get all the ladies to get together and go and do this BRCA gene, because it will predispose you to get the cancer. So if you know anybody in your family had this, then it's important to, you can diagnose that. In special other countries, yes, they have easily they can do, but we can't do because we don't have that much of money. But this is for the ladies, if you get to know, it's important that you know that you have this gene, so you are going to get breast cancer. I think you know the famous actress Angelina Jolie had that. So I think she removed the breast before getting the breast cancer. And medical history, your history, what happened to you if you had a breast cancer diagnosed earlier. So sometimes the biopsy will tell you, some biopsy they will say some changes, or you had a breast cancer, so there for the next 25 years you have a risk. You can get the recurrence or re-emerging of this breast cancer. So if you had a breast cancer and if you are treated, you can't just ignore. Other thing is the chest wall radiation. If there is a radiation given to some other cancer or some other thing for your chest, if there is a radiation given, then there is a 10-fold increase of that person getting a breast cancer. And the hormone replacement therapy, this is the combined pill. You know, most of the ladies, sometimes when they get menopause, they get severe symptoms like sweating and very difficulty in the body. They have difficulties in the body, and then sometimes they use this hormonal replacement therapy, which is called the HRT. And if you are using HRT, and then there is a chance, if you use it for more than 5 years, and there is a chance of 15% chance of you getting the hormone replacement therapy. If you are getting hormone replacement therapy to get a breast cancer. So usually if you are over 50 and if you have a family history, it's recommended that you should not use hormone replacement therapies unless it's very difficult situation. And the next one is oral contraceptive pill. There is a slight increase, not that you are, if you take oral contraceptive pill, you are not going to get a breast cancer. But once you reduce if you are taking it for a longer time, the risk is there. And then the risk decreases after stopping. If you stop the oral contraceptive pill, so this the risk is going down. And this hormone replacement therapy also, when you have taken for a long time, and if you stop it, after about 5 years, the risk will go down. And the factors related to the reproductive system of women. So if you had early menarche, if you became a big girl before the age of 11 years, and if you stopped your periods after 55 years. Why is this? Because for a longer time, if you get menarche early and stop it later, then you are exposed to your estrogen hormone. These hormones, you are exposed to hormones for a longer time. So because of that, this type of ladies will have a increased risk. And ladies who don't have children. If you are an nulliparous woman, and then your chance also high. And then the other thing is, if you got your first child after 30 years, then again, your risk is high. And breastfeeding, that's why we always tell breastfeeding is good. Breastfeed, because if you are breastfeeding, the relative risk, it will every month, if you are breastfeeding every month, the risk will go from 4% down, because then you are not getting exposed to your hormones while you are breastfeeding. So don't get scared listening to me, because not that if you have one factor, you're not going to get a breast cancer, but all this, if all these things come together, combined factors will affect your situation to get the breast cancer. And lifestyle. So this is important. This is not only the breast cancer. I think it's important for all of us. If you are overweight, especially after you stop your periods, if you're fat, then again, you have higher risk of getting a breast cancer. So the other thing is physical activity. If you are active, so the active women will have a less risk. So try to be thin and active. So especially after your menopause. And alcohol consumption and smoking. These things are, earlier we thought it's not very relevant to our country, but it's coming up now. So the younger generation is getting used to these things also. So if you are consuming alcohol, 1 drink a day increases the risk by 4%, and smoking also increases the risk. So why we are talking too much is that you can, as Dr. Suraj said, this is not a deadly disease now. So our problem is we are not detecting early. Why we are not detecting early? Because we just ignore, we just think it's not going to affect me. It's not a big problem. So I'm going to tell, no, it's a problem. If you detect these things, I'm going to show you the symptoms and signs. And then if these symptoms signs are there, then you have to take care. You can't just ignore. So first thing is, I think you can see this picture, recent breast asymmetry. So this is if there is a difference. So to detect all these things, there is a thing called breast awareness. Every lady should be aware of her breast, because you should know what is your normal breast looks like or how it feels. So if you know your breast, you will detect if there is a small change, even you will know it was not there and it came back recently. So because of that only, we are talking about breast asymmetry. You can see there is a difference in the breast. The other one is a lump. So it can be painless. It may not have pain. You may not have pain, or you may have pain or a fullness in the axilla. So these things sometimes, this is a very important point, because most of the time ladies, sometimes there are lumps which are benign, which are not cancers. But any lump, until proved otherwise, we have to think about a cancer. You can't just say it's not painful. It's not because I have a personal experience. One of my relations, she was telling me I have a lump. I said, go and show. Then she said, no, it's not painful. She was giving me 1,000 excuses not to go to a doctor. So ultimately I had to threaten her, don't call me hereafter. So ultimately she went, and it was a cancer, operated. Now she's well, because I had to shout at her. So if there is a lump, please don't take it as a simple thing. It's nothing. It's not nothing. Until you prove that it's not a cancer, it may be a cancer. So the other thing is a dimple. So you can see, I suppose there is a small dimple somewhere here. Can you see the screen? Small dimple somewhere. it's like a suliak, some dimple. Can you all see my screen? I suppose.
Yes,
You
yes,
can
doctor, we
the
can see.
picture.
Yes, doctor.
You can see, no? Right, yeah.
Yes.
So dimple will be, you will detect this if you know your breast. That's why every woman should be aware of her own breast, right? So this is also a dangerous sign. And redness. So if you suddenly realize that your breast is red without any reason, then again you have to go for the medical advice. And the nipple, retracted nipple. So this is sometimes they complain when they are feeding the children, they say the nipple is not coming out, but I'm not talking about that. You suddenly notice that one of your nipples getting inverted inside the breast. So that is again a danger sign. And the Paget's disease, this is a different situation, but in this situation, there is some redness, scaling, and ulcers around the nipple. So when these changes occur, then this can predispose to cancer. So because of that, if there is any ulceration, any excoriation, any changes around the nipple, then you have to seek medical advice. And the next one is the change of the breast. So the skin, if you suddenly find your skin of your breast is changing, if it becomes thickened, and you can see that this appearance, which medically we call pod orange appearance, it's like an orange. So if there is a change like this, again, this is also a danger sign. And sometimes you will have a nipple discharge. So when you are pregnant, you have nipple discharges. So if you are on some thyroid medication, there are different situations where women can have a nipple discharge. But if you are having a nipple discharge, especially if you are older, if you have stopped your periods and you have a nipple discharge, and it may be milky, or it may be some other off color, or it may be blood. So whatever it is, unless you are pregnant, if you have a nipple discharge, then you have to be aware of that and you have to take action. And the pain in the breast. So this is sometimes, I think all the ladies will agree with me, when you are getting your periods, closer to your periods, then you will have pain or you get some discomfort in your breast. So this is not that discomfort. This is a different type of pain where when you can't explain, it is not related to your periods, but you get suddenly, especially in one breast. So if you get a pain in your breast, not related to your periods, it's not a cancer, but it is maybe a predisposing to a cancer. So these symptoms I'm just informing, so you will be aware these things should be taken care of, not to ignore these things. And then again, a lump in your axilla. This is common for ladies who are fat. Sometimes when you're fat, you have a lump-like thing in your axilla. But then if you know your breast, you know it was there from your when you were young, you had this thing for a longer time. But suddenly if you find that there is a lump coming in your axilla, then again, it may be a danger sign. So now I have told you so many things. So how the new concept is TLC, tender loving care. So give the tender loving care for your breast. T is touch. Touch and see whether there is a lump, pain, lumpy areas or anything. So touch and see. Then the look. L is for look. So size changes, shape changes, skin color, texture, and changes in nipple. So if you find these things, the third thing is check. So if you find any changes, you have to check these things to make sure that it's not predisposing or it's not going into a cancer. So remember TLC if you can't remember everything. Right. So how can we find, what are the modes of detection? So first thing is, as I told you earlier, the breast awareness. Be breast aware. You know your breast, otherwise you won't find any, if there's a small change even, you won't notice it. So the second thing is self-breast examination. Every lady can do this because we can't, in our country, we can't go for mammography and all these investigations, but every lady can do a self-breast examination. The third thing is we can do a clinical examination. You can go to your doctor and get the examination. And then the ultrasound examinations, the mammography, and then the biopsies. So these are the methods, but the important thing is that today we are concentrating on self-breast examination. So why you want to do it? Because you are going to detect early if there is any change in your breast. Then when should you examine your breast? Usually 1 week after the menstruation. Because during menstrual period, most of the ladies will feel sometimes the breast is little lumpy or it's tender. Because of that, don't do it during the menstruation, but do it about 1 week after your menstruation. But if you are a menopausal lady, if you have stopped your periods, then every month you have a fixed date where you can examine your breast. And how are you going to examine the breast? So this is the important thing. So there are 3 methods. One is you look at your breast and then you palpate your breast. So first we'll concentrate on how you are going to look at your breast and find these important changes. So one thing you have to examine, usually what is recommended is you have to go in front of a mirror. And you have to remove your clothes up to your tummy and then stand in front of a mirror and then keep your hands on either side and then look at the changes in your breast. So just relax and see whether there is any changes. The second thing is then you lift your arms. You lift your arms up and over your head and look for it, because when you lift your arms, the breast will become more prominent and you can see the underside of the breast also. So you can see the change. The third one is you have to keep your hands on your hips and press them firmly in your hip. And then this help to flex the muscles and then you can see the abnormality. So I think you can remember just stand, relax and stand. Raise your arms up over your head and then keep the hands on your hip and press them. So these are the things for inspection of your breast. And then the palpation. You look at your breast, then you have to feel and see what you are going to feel. How you are going to feel with your flat portion of your 3 middle fingers. So fingertips, you must not dig. So it is fingertips, you should not palpate with fingertips or not with the palm. So middle part of your 3 middle fingers. So when are you going to palpate? One is you can stand and do, or you can sleep and do on a bed, lying down position, or you can do it when you are having a bath. So I think whatever easy for you, you can select, but it will be very easy during a bath to examine your breast. So this is the way you can do in 3 steps. 3 means you can do the softer, the superficial palpation, like you do superficially, you palpate your breast and then put little pressure and apply little pressure and examine, and then apply hard pressure, and then you can do the superficial or middle or deep palpation. So 3 ways you can do the palpation. So this is what I'm showing. This is the lying down position and this is during your bath. So this is an easy way to examine the breast. And the motions, how are you going to examine your breast? So one is the circular motion. You can see the circular motion, but you have to examine the whole breast. So starting from one point, go round. So palpation, you go round and do the circular motion. The other one is you can go up and down. So up and down, you go the up and down motion. And the other thing is the wedge motion. From the nipple, you go outside. Right? So 3 ways of doing the palpation. And then after you do that, you have to palpate your armpit, because I said sometimes the breast, you may not have any lumps, but there may be a lump or lymph node in your armpit. So the breast cancer beginning will be in that armpit. So if you detect that, so that is also, this is again, I'm telling you, I want to focus it again and again, because if you had done this, then you know that there was no lump before and suddenly this thing came up. So that will be important, because if you know your breast. And where should you, before that, shall I again give you a little thing what we have to do? First is you have to look at your breast in front of a mirror, relaxed, arms up, and then arms on your hip. So you can do this, the inspection, and then you palpate. You palpate either standing or lying down or during your bath. And then palpation methods I have shown you. So where to go? If you find something, some difference, then where to go? I'm sorry about this Sinhalese words, because when I put it, the words are coming like this. So you can go to your family doctor, you can go to the OPD of the nearest hospital OPD, and there are some clinics, Suvanari or Suvadivi clinics at MOH office or hospitals. So these clinics also, you can see from your MOH, some MOH offices, they have special breast clinics. And there are, in some hospitals, they have special breast clinics. And then, as Dr. Suraj said, the National Cancer Control Program will always welcome you all to get the examination done. So the screening protocol, there is a screening protocol. This is very important. And as earlier also told to you, the self-examination. Now I have told you what you have to examine. So self-examination every month by all women from 20 years. Because 20-year-olds also getting breast cancer. So you can't say because I'm young, I'm not getting. It's not like that. So every lady should do the breast examination every month, especially 7 days after your periods. This should be done. And then the clinical breast examination, what they advise is every 3 years for all women, 20 to 40 years should go to a clinic and do the breast examination, should be done by a doctor. 20 to 40, and after 40 years every year. So I know our ladies will never go. If you ask, they say, I'm shy, how can I go and ask to examine? So many excuses are coming. So right, if you can't do this, at least please do this. If you do this, then you can decide on this thing. So I know everybody says, no, I'm shy, I can't go, how can I go to it? But there are so many lady doctors available. So you can go and find a lady doctor and show. And then the other people who had relatives, if you had somebody who had your first degree relative who had a breast cancer or an ovarian cancer under the age of 40, if somebody of your immediate family had that, then you have to get the examination 5 years before the index case. Suppose your relative, your sister had at 40 years. So you have to start examination at 35 years to prevent or detect early. And then mammography, it is after 50 years, it's available, but we don't have this facility. But this is especially recommended for anybody who had a family, who had a family history, or the immediate family member had a breast cancer, your family, my father's or mother's side, if they had breast cancers, and if you find a lump or something, then please you can go and tell the cancer screening, the National Cancer Prevention Control Program. They are always ready. If you have a special history to tell that my mother had a breast cancer and I am having a lump, yes, they will get you before 50 years even. So it's very important. This is the screening. So this is again and again, we are telling even our friends, everybody, we neglect. And after diagnosing the breast cancer, then it's gone far beyond where we can't do anything. So we can prevent, you can operate, we have medicine, so it's preventable, it's not deadly like Dr. Suraj said. So I have come to the end of my story. I think I help save the girls because it is my obligation to help ladies. So one point I can tell you is that ladies, everybody, you know, the our husbands, brothers, everybody, father, everybody's laughing at us saying you all are chatting all the time. Yes, I agree. We all chat all the time. And what do we chat about? We chat about saris, jewelry, cooking, so many things. So I'm requesting you to your chat box at the breast cancer awareness. Now, when you're chatting with a friend, just tell them there is a thing called this. So if you all have a breast, if you know somebody had a breast cancer, then tell your friend, you palpate, you do this and find early. And because I have given the message that one person can't do, this is the duty of all the ladies to educate your friends, your relations, all the ladies, your friends, your mothers, your friends, your daughters, everybody included. So I think it's ladies, it is we for us. So take this message and help all the ladies and get them to get diagnosed and get cured early. So this is Cleopatra. I took it, it's my photograph taken in a museum in New York. So ladies are very beautiful and the breast is additional beauty for you. But then it's our duty to prevent and protect our health because you think it's not only you, as we told earlier, it's your family. Your children are going to lose the mother. Your sisters are going to lose the sister. Your mother is going to lose the daughter, and you are going to lose your best friend. And then, ladies, so it's up to you now. Thank you very much for your patience listening.
Thank you, Dr. Manel Fernando, for your informative and interesting session. Finally, this is the time to get answers to all your questions. Ladies, please feel free to send your questions through the chat box without mentioning any name or on WhatsApp or directly to the consultants we have here today. You can even ask on behalf of a friend if you do not wish to disclose your identity. Whichever way, we hope all your doubts will be cleared and clarified today.
Yes, friends, you can unmute and ask the questions. I know there are a few hands raised one by one.
Jeewantha sir, can I ask? I may be the first.
Sure, you can ask.
Good evening, doctor, and good evening to everyone. Doctor, you are really great. You just gave many suggestions to us. Actually, I just came in this program because I just went through a small surgery. There was a mass of lump in my right breast. I just went through it. It's been just 15 days. I am just scared that I have already removed that lump. But is there any possibility that I may get any cancer or something like that? Because my grandmother, my father's mom, she had breast cancer and she died. And my mother also, before 3 years, what we did, like you showed in the picture, the nipple goes inside, and she used to like a mother feeding milk. She used to just discharge milk from her breast. The milk used to be discharged. So we operated it and removed that. Now she is fine. It's been 4 years, and suddenly I got the mass lump on my breast. It has pain also, but now I have removed. Is it good to remove, or will I get any other symptom of cancer or something like that, ma'am?
I think when they removed the lump, I think they would have done a biopsy. They would have tested that the lump to see whether there are any tissues, any dangerous tissues in that lump. So the thing is, then they would have given, because of your family history, because you say that your mother had a cancer. So I think you had to go on for the screening, the mammography and all those things wherever available. You have to do a screening. You have to go to a screening. Are you going for a screening at the moment?
No, ma'am. Actually, I had screening like FNAC test, ultrasound test, but they didn't do my mammogram. They just requested me to just cut and throw it. So as the doctor said, I did the same thing. Within the second day, first I visited the doctor. He asked me some test like USB test, ultrasound test, and FNAC. Then after that, they removed my tumor, that lump, and they asked me to do biopsy. In biopsy also, I didn't get any bad result. So he said, you don't have to worry. But I'm scared, ma'am, that's why. I have lumps. I have still some lumps in my left breast also, but it's not painful. And I asked doctor also, he said, if it's not paining, and he checked and he said, it's not dangerous, don't worry. But the present lump of right side is dangerous, so you have to remove. I have already removed mine. It's been 15 days.
15 days. Suraj, you want to add something?
Thank you. Now, I think you may got your histology report after biopsy. So I am wondering whether it is fibrocystic disease or fibroadenoma, because those are benign lesions, not cancers. But considering your family history, I want to consider you need regular checkups now. What's your age at this moment? So if you pass 40, you need mammogram, because now you are not a general. You are not eligible for general screening because you are in little bit risk category. You need to go to another schedule. So better to consult your family doctor or the surgeon who operated you. So he or she may put on to some kind of follow-up schedule.
Okay, sir.
Because normally before 40 you are put on ultrasound examination for follow-up. After 40 you will be put on mammogram plus or minus ultrasound. Yeah, and keep your histology report also, because it may be helpful for further follow-up in future. Please check whether your histology biopsy report says benign report, because you said that it is normal. So it may be fibroadenoma or fibrocystic disease, I am guessing.
Actually, my biopsy report says features are suggestive of fibroadenoma. ATP are not seen.
ATP are not seen means no change of malignant, no towards malignant. So generally you have a non-cancerous lesion, but since you have a strong family history, you need to be put on to a regular checkup.
Yeah, sir. Yes, sir. Yeah.
Yearly checkup may be adequate.
Yes.
So please sit to a family doctor or your consultant who operated you.
Yes, sir. Yes, I will go because he has again called me for the regular checkup after 1 month also. He asked me till 1 year you have to just come every month. I said okay because I'm scared. That's why, sir.
Yeah.
Thanks. She is from not from Sri Lanka, Dr. Suraj. She is from Nepal.
Nepal, sir. I'm from Nepal. Thank you.
Yes, thanks. There's another participant has raised hands.
Yeah, good evening, Dr. Manel, Dr. Suraj. Thank you for your valuable information. I'm Rusiri from Modramata, Kulia. I have a few questions to find out. If you have a history of cancer in your family, how often we need to do the mammogram?
That depends on your age, I think. Again, we have to.
I'm 43.
Yeah, that you have to do if you have a family history, I think then you have to do your breast examination and the clinical examination. I think she's qualifying for the mammogram after 40 now, because somebody had only one person in your family.
Yes, like my grandmother had. So
I think she's qualifying for a mammogram, I think.
Yes, after 40 years. Because
and how often we have to do it, doctor? Every year or?
First go for the first mammogram. Then after that, you will be put on to a schedule. So it depends on the requirement.
And is it a painful process or is it?
there will be little pain because between two plates, your breast will be pressed. There will be little pain. Yeah.
Right. And like what Dr. Manel said, like if you have a cancer lump, is it painful or is it, how do you find the difference? Like, is it a normal one without painful one, or is it a painful? When you do your self checkup?
Yeah, if you find a lump anyway, you have to get the clinical examination, because lump is, as I told, until proved otherwise. It may be, right, that earlier lady told, it may be a fibroadenoma or adenosis where you have little pain. But when you detect, because that's why if you are breast aware and if you suddenly detect a lump, you have to go for a clinical breast examination. Because you can't just say because I have a lump, it's not malignant. No, you can't say like that.
Right. Thank you so much. Thank you. Thank you, Dr. Jeewantha. Thank you.
Dr. Suraj, there's a question in chat. In fact, I think this question has been raised from a participant from India. It says, Dr. Suraj, you mentioned that women are advised to do mammogram only after 50. Is that in Sri Lanka? As I know, UK and USA advised to do it earlier. I think you explained this, but as it was there in the Q&A in the chat, I just want some explanation from you, Dr. Suraj.
Yes, so it depends on the country guidelines. Now, in Sri Lanka, it is recommended from 50 onwards. UK also generally it is after 50, but recent years there was discussion to reduce to 1 or 2 years before. That means from 48, like that way. But only USA, we are aware that it is routine mammography started from age for 40 onwards. That is for normal females, not for this risk category. So if you are in a family, if you are having a risk factor, so then medical team will decide whether to go for an early mammogram or later. I am preferring the routine mammogram for a apparently healthy female without having any additional risk.
Thanks. Another question in the chat, I think either Dr. Manel or Dr. Suraj can answer. I have done mammogram in 2016. Is it necessary to do it again? And how often? That's a question I think you may have answered, but I just want to reiterate again.
Yeah. Generally, it says if it is routine mammography every 2 years after 50, but if that mammogram is conducted for a reason, for any change, having a family history or any risk or any lump, in the final report, the consultant radiologist or the surgeon may have given some advice to repeat after 2 years or 3 years. So as a blanket thing, I can say after 50, it is every 2 years. Before that, it depends on the condition, the report status, as well as the reason why mammography was conducted before the age of 50. You need to consider that also.
Thank you. There's another personal message has come on chat. It says the sender is really scared of going for a mammogram because her friends has told it's really painful. I think we have to give a answer because I think she wanted to go for mammogram, but she says her friends has told it is really painful, unbearable pain. That she has used that word. Is it true?
I think it depends on how you perceive pain. Everybody won't feel the pain same way. So sometimes what I feel, nothing may be painful for the next person. So you can't just say, I think it's little painful, as I have heard. So, but it's not that really painful, and you don't have to do, you can't do. It's not like that, because your friend may be perceiving pain in a different level. So that is one. And other thing is, you want pain or life? That is my question. If you are having any problem, if you don't do the mammogram, and then if you are diagnosed with a cancer, it will be more painful, things will follow. So taking on to the life, a little pain, I think you can tolerate. Yes, Suraj, I think Suraj is going to show.
Yeah. So I think among the audience, there may be females who have undergone this mammography examination. So, so there will be two plates. Between two plates, the breast need to be pressed to get the clear picture. So there, I can't say there's no pain. There will be pain, little bit pain. It depends on the as Dr. Manel mentioned, that how you feel, how you perceive pain, as well as it depends on the sometimes the machine quality, as well as the radiographer who handles the thing. So all these and the atmosphere prevailing at the investigation room. So all these things contribute for the ultimate thing. But generally, every females who are coming now in our center also, we used to do mammogram, but there is no major complaint that they suffered a lot, because we are getting female radiographers from National Hospital where they have done so many mammograms. So our radiographer is experienced enough. In the private sector, there may be some, I can't say all are trained, because sometimes we notice that sometimes there may be concerns that untrained people are also involved in mammography investigations. But according to the law of the country, the registered female radiographer need to perform the test. So they are also well, because in Sri Lanka also at the moment it is allowed only female radiographers to do the test, not by the male radiographers. So don't consider pain, because our ultimate aim is to detect a suspicious lump as early as possible.
Thank you, both doctors. Are there any questions, participants? You can unmute and ask. I have referred all the questions on chat.
And other thing is now, in most of the places now, they are upgrading their mammography machines from analog to digital. When digital machine is available, also the pain is a little bit less, because the picture quality is very good compared to analog ones.
Dr. Suraj, there's another question in chat. Where are breast MRI conducted in Sri Lanka? What are the, I think, what are the places breast MRI conducted in Sri Lanka?
Breast MRI is available in RC Surgical, but it is because in some countries it is used also for mammography screening. But for whether you need breast MRI or routine mammogram, you need to discuss with the your consultant radiologist. So don't straight away ask for breast MRI. So it will be decided by the consultant radiologist, or in instances where the exact locality need to be identified for conservative surgeries, surgeon may request.
Doctor, there's another question. Any of you can answer. Doctor, is there any connection between cancer in the lymph nodes and breast cancer?
The breast cancer that as I have shown in the previous picture, the organs, usually our body, the organs will get the lymph flow. So there are lymph nodes which will drain different type of organs. So like the same way, it's not there are different things for lymph node cancers, but breast cancer, what happens is the cancer cells can go from the lymph and get deposited in the lymph nodes. So sometimes if the cancer cells are hidden, then once you remove the breast, if it is there, then it can grow again and get the cancer again. So the connection is that even any organ is draining, even if it is another cancer, even any other place, usually what they do is then they remove the organ, they remove the connected lymph nodes, because the lymph nodes are the places where the cancer cells go and hide. I think I answered the question. Is it okay for the person who asked the question?
If need any clarification, you can unmute and ask. Yeah, exactly on the timing.
No, doctor, thank you. It's very clear. Thank you very much, doctor.
Right. Thank you. And if there are no further questions in chat, of course, if you have, you can directly unmute and ask, because I have not restricted out that. If not, I'm handing over the proceeding back to the chairperson of Lions Ladies Committee, Dulanthi Gunasekara. Over to you.
Thank you, participants. I believe you grabbed the maximum advantage during this program and clarified all your issues. I now invite our patron, Lion Marian, to do the announcements. Over to you, patron.
Lion Marian. You are muted. Lion Marian, you are muted.
I'm sorry. District A1 Lion Ladies Committee has invited us for a project to do with them in Jaffna. That is a service project at Telipale Trail Cancer Hospital on Sunday, 17th of October 2021. So if the country situation come back to normal, I hope to visit, and I request Jaffna Lion Ladies to participate for this project. So they actually request nutritional support and the education materials for children. So if anybody likes to donate, you all can donate this item. That's all.
Thanks, Chairperson. There are a few further announcements. Actually, this is a good project, joint project with two districts, Lions District, District 306A1 Sri Lanka and District 306B1 Sri Lanka at the Telipale Trail Cancer Hospital, Jaffna. This is the hospital that this current year, our district governor, Lion R.L. Rajkumar, is focusing to do the LCF grant project for development of a intensive care unit, small intensive care unit in this Telipale Trail Cancer Hospital with oxygen facilities, with the oxygen plant and a few other machines. So I'm just announcing all the ladies to join hands with the Lion Ladies Committee. And few announcements, my dear friends. On 28th August, next Saturday evening at 7 o'clock, under the leadership of our first Vice District Governor, Dr. Anoma Vijay Singh, And New Voices team has organized a project management development program. It will be in mixed languages, in Tamil and English. So I'm inviting all of the lions and lion ladies all to join on learning how we can arrange, organize, plan a service project as a service focused organization members. So thanks to first VDG, Dr. and Dr. Anoma for organizing this event with the New Voices team. It is on next Saturday at 7 o'clock through Zoom, 28th Saturday. And also, my dear friends, another event which has organized on the 1st of September, it's a joint project with Indian District 3231 A2, India. It's on diabetic awareness, sorry, 3231 A2, India. And it's on diabetic awareness program from 7 to 8:30 on 1st of September 2021, a joint project with our lovely Indian Lions. And the other announcement is, my dear Lions, all participants, as we are having a good number of participation that we thought of this information is being shared, is the Leadership Development Institutes, 2 institutes that we have prepared, ELLI and RLLI. We have already circulated all the instructions. I'm inviting all of you to apply for ELLI upcoming club leaders, incoming club leaders, including the current year club presidents and the club officers who are aspiring to planning, dreaming to be club presidents, and also RLLI, the previous club year presidents and above grade lions can apply for RLLI program, which both circulars has been issued. The application will be closed on 31st August. Even right now, yesterday night we released these circulars. By now we have received a large number of applications. So thanks to everyone who applied. And also I'm announcing all of you to apply without any further delays. 3 days, 2-night residential workshop, Lions Club's International Certified certificate, and also PIN will be awarded. Is the international curricula that the all certified trainers are doing it for all of you all. And also finally, invitation to all non-lions to join hands with our Lion Ladies Committee, a very strong committee in our district 306B1, for join hands with the Lion Ladies Committee. All can contact either of them or even any of the lions, lion ladies who are here, and join with our lion ladies. Rather than lion ladies inviting, I wanted to invite on behalf of lion ladies, keeping my lion lady next to me. So invitation to all of you all. Finally, before handing over the proceedings, I should thank all lions who has joined from Nigeria, Nepal, and India, whom I have personally invited also. And also, I appreciate the presence of Dr. Manel Fernando Consultant, a highly qualified professional, also has joined as a motivational factor to all our lions. Over to you, Chairperson.
Thank you, Patron and Lion Dr. Jeewantha. Finally, it's time to end this session, and I call upon Lion Shiromi Leonard of Lions Club of Jaffna to propose the vote of thanks.
Thank you, Chairperson. It is an immense pleasure to thank our District Governor, Lion R.L. Rajkumar, and our Patron First Lady, Lion Marian MJF, International Director 2011 to 2013, Lion Sunil Vatavala, immediate past District Governor, Lion A.L.R. Haj M.I.M. Razik, and Lion Rizana, first Vice District Governor, Lion Dr. Anoma Vijay Singh, and past District Governor, Lion Lakshman Vijay Singh, and second Vice District Governor, Lion Placidus Peter MJF, and Lady Lion Savitri, and all past district governors and their gracious ladies. Leo District President, Leo Minoli Perera, thank you very much for all your presence, which will be a motivation to all our Lion ladies. I extend my sincere gratitude, especially to today's guest speaker, Consultant Dr. Suraj Perera, and our own Lion member, Dr. Manel Fernando, for both of your informative sessions shared with us today. My special thanks to the committed leadership extended by the Chairperson of Lion Ladies Committee, Lion Dulanthi, and the entire Lion Ladies Committee. Finally, I should appreciate all the participants today, Lions, Lion Ladies, Leos of the district of 306B1, Lions from sub-district of multiple 306, Sri Lanka, Lions and Lion Ladies from India, Nepal, Nigeria, and non-lion friends from Sri Lanka, India, Canada, and UK. My dear friends, once again, I thank each and every one of you and inviting you all for our next learning program, which will be communicated to you all in due course. Thank you so much and may God bless you. Thank you once again.
Dear Chairperson, I need your permission because I'm going to, my dear friends, two things. One is just another announcement, I missed it. That is another joint service project with District 324M, India, and District 306B1, Sri Lanka, with Indian District 324M and our Sri Lankan District 306B1, our own district, with the support of Lions Club of Colombo Granville. They are doing another joint awareness program on COVID-19 on 28th August at 6 p.m. And also, my dear friends, before we are closing it, I need the feedback where our district governor wanted me to give your feedback on this poll. And also you can use the chat and give your feedback as well. Use this on the screen. You can give your feedback whether how you are going to rate it on this free seminar and your appreciation in the chat box. We use few words where our organizers, our chairperson, and also patron, and all our Lion Ladies committee members would be really happy to see your feedback on that. I saw many positive feedback were there about the program, and it's a really motivation factor because our patron and Lion Ladies committee chairperson and all the committee members are focusing on some more learning sessions for your betterment, for the betterment of our mothers, our sisters, our friends, all, because women are the power. So because my landlady is also here. So I'm going to close the poll. We have received almost 53% has responded on the program, and lot of comments also in the chat. So I close the poll as we are up on the time, and it's really good. And I should see our patron and all our Lion Ladies would be happy to see this. Almost 94% of the participants has told excellent, very informative session, and 6% says good. And so with that note, I'm handing over back the session to our chairperson of the Lions Ladies Committee, Lion Dulanthi Gunasekara. Over to you.
Thank you, Dr. Jeewantha. Now I terminate this breast cancer awareness program until we meet very soon with another learning session important to our ladies. Stay safe and God bless you all. Thank you, Jeewantha.